women have heard that if they're a virgin, they shouldn't wear tampons. In fact, there's no reason why young women shouldn't wear tampons. Tampons allow them freedom to do the sports that they want to do and to enjoy the life the way they'd like to. By, by, by ignoring the ability to use tampons, they really cut out a piece of that life. Some women have heard that they shouldn't exercise or have sex during their period. There are no adverse consequences of exercising during the period. In fact, many women find that they have fewer cramps and less bleeding if they go ahead and continue to be active during their. Some people think that breast cancer is the leading cause of death in women. In fact, heart disease is the leading cause of death in women. Heart disease is responsible for about 50% of the deaths in women. The guidelines regarding pap smears have changed in the past few years, so we no longer feel it's necessary to have a pap smear every year. Some women have misinterpreted that to mean that they don't have to have an annual exam every year. But in fact, annual exams include much more than pap smears. It's an opportunity to review medicines, to review family history, to find out what sort of problems are happening in one's life, and to practice preventative medicine. So to look for breast lumps that a woman may not notice herself, to check the pelvic exam and see if anything has grown or become abnormal, and to talk about diet, exercise, and healthy lifestyles. So it would be a mistake to avoid the annual exam just because you're up to date with your pap smears. Continuously, the lining of the uterus gets thinner and thinner and thinner until there is nothing to come out. So there's no fear of the blood going to the wrong place or not coming out or building up. In fact, it's quite safe to take the pill continuously and not have periods because of it. Anytime you're on the pill, so taking the pill continuously has the same efficacy in preventing pregnancy that it does to take the pill in the old-fashioned way. In fact, it probably works even better because you're not having the receptive lining of the uterus that you would have otherwise, and you're not having as much problem from women forgetting to take a pill. The worst time to forget a pill is after you've been off for 7 days. And so by never taking a 7-day break, you're much more likely to stay with the program. Certainly a myth to think that premenstrual syndrome is all in the mind. Over time, we've come to understand how the changes in women's hormones can affect many things about their bodies. So during the 2 weeks prior to the period, many women will experience more fluid retention, more mood changes, more breast tenderness, bloating, a whole series of symptoms that do relate to measurable hormones in their systems. Many women feel that because they don't have a family history of breast cancer or ovarian cancer, they don't need to worry about those cancers. In fact, 80% of women to get breast cancer do not have a family history, and the large majority of women to get ovarian cancer do not have a family history. So the absence of a family history does not mean you're safe. If you have breast and if you have ovaries, they need to be checked.